Thank you everybody for coming today. My name is Elisabeth Davies and I am a mental health counselor. I've been a counselor since 1989 and I've been in private practice since 1993. I have worked with thousands of clients who have struggled with addictions, anxiety, depression, eating disorder, trauma, abuse, and then I also do a lot of relationship counseling for couples and families going through divorce. I love motivational interviewing. I use it a lot, probably a little bit in every single session, not as a standalone treatment, but I intertwine it with other treatments that I use to treat mental health disorders as well as substance abuse disorders. The learning objectives I have for you today is to kind of understand the definition of what motivational interviewing is, when to use motivational interviewing, in what circumstances to use it. So we'll start with what the definition is. Motivational interviewing is a collaborative conversation style designed to strengthen a client's personal motivation and commitment to a specific goal. We, as the helper, help elicit or evoke their own reasons for change by creating an atmosphere of acceptance and compassion. What happened is actually motivational interviewing was first developed in 1982 in Norway, and then Dr. William Miller helped bring it into the United States and wrote his first book on it in 1991. He did over 10 years of research prior to writing his book. He was working in an addiction treatment facility inpatient. And his colleagues were working with these substance abuse clients, and they were complaining to him about, oh, these clients are so difficult, and they're in denial, and they're resistant, and they're out of touch with reality. And when Dr. Miller was working with his clients, he experienced none of that. So he thought, is this really a client issue? Or is this really a counselor skill issue? Well, guess what he learned? It was a counselor skill issue. And the counselors that were working with people struggling with alcohol and drug addictions were not conversing with them and having conversations with them in their approach that was effective, and it was causing resistance in the client. So why would you use it? Well, Dr. Miller and Dr. Rolnick found that it had 1.5 times the abstinence over current interventions. He found that when treatment providers used what he calls accurate empathy, meaning actually caring what the client who has the alcohol or drug problem, what their perspective was, how they came to make the decisions that they did. He found that when therapists used that type of approach, there was 51% less alcohol use over the current treatments at the time, where a lot of the inpatient treatment facilities at the time were using 12-step and cognitive behavioral therapy. There's two major components to motivational interviewing. The first one is relational. Relational is the most important. In fact, if we don't set up a collaborative relationship with a client struggling with alcohol and drug abuse, none of the other techniques for motivational interviewing will work. In a collaborative relationship style, again, we're coming across as working with the client rather than telling them or directing them how things should go and what they need to do and what decisions they need to make. The technical component to motivational interviewing is how to evoke their strengths and resources and call them forward. And so one of the ways we do this is through open-ended questions. An open-ended question is a question that you don't have a yes or no answer to. So one of the questions that I frequently use with people struggling with alcohol and drug addiction is I say, what kind of a life do you need to create that would make you want to stay sober for it? This is the most important point, I thought, in studying motivational interviewing and using it for several years in my private practice, is that if people do not experience themselves as acceptable, it blocks their ability to make a change. I just want to say one other thing about acceptance. Acceptance does not mean approval. So when I accept someone and they come in as they are and they've made poor choices or destructive choices, it doesn't mean, oh, I approve of your choices. It means I accept you where you are right now. With change, there's usually ambivalence. Ambivalence means that in our mind, we have an argument of why we want to stay using alcohol or drugs and why we don't want to use alcohol or drugs. So this is where we need them to come up with their own reasons for change. Why do you think you have a problem with alcohol or drugs? Might be one of the questions we might ask. There's 4 skills for us as the helper or counselor to use. The first one is the acceptance part that I already talked about, prizing their inherent worth. The second one is accurate empathy, actively interested in understanding their perspective. The third one is autonomy support. Every adult and children as well, have what's called free will. We have the ability to make our own choices. And when someone tries to come in and thwart that, it causes resistance or defensiveness on our part. The fourth one is affirmation, acknowledging their strengths and efforts. Prior to coming to us, maybe they've made some attempts. Maybe they've tried on their own to already quit smoking cigarettes or drinking alcohol or using heroin. Maybe they've already tried to go to a 12-step meeting. Maybe they've already been through rehabilitation once or twice. And for us to acknowledge that before they came to us, what efforts did they make, and to encourage them in all of their efforts that they have made. So there's 4 key processes when we're using motivational interviewing, and the first one is engaging them, and that's that part we talked about before. The most important part is establishing that collaborative relationship. Does your client trust you? Do they know that you're here not to direct them on what goals they should make, but really here to support them in their own goals of what they have in life? The second one is focusing. Once a client tells us, I don't want to be shooting up heroin anymore, as soon as they voice their desire to make a change, then as a treatment provider, we stay focused on that change talk with them. How's it going with your goal? Is there anything you need from me that I can help support you with your goal? Any information that they are wanting you to share with them? Even your own story. That's one thing I love about 12 Steps, when you go in there and everyone shares their own story, right? It can help people think of new ways. If one person can get sober, maybe I can get sober. So sometimes sharing our story is another way that can really inspire people. Third process is evoking, eliciting motivation through open-ended questions. The fourth key process is planning, formulating a concrete plan of action that the client is motivated to follow. Not that we, as their treatment provider, has designed for them to follow. When would you apply motivational interviewing? When conversations about change are happening. When the individual is ambivalent about making change. So anytime there's ambivalence about making change. I had a client who had just gotten out of jail for crystal meth use, and he came to see me, and his ambivalence was, you know what, when I was dealing crystal meth, I made thousands of dollars a day. Now I'm 34 years old, living with my parents, $8 an hour job. Really? No, I don't know if my life's better. But I have this girl that I really love, that I really want to marry. So see, the commitment language goes to like my needs for changing. So I think I'm going to stick with not dealing crystal meth and stay out of jail so that I can marry this girl. So when the goal is adherence and retention to treatment, when staff complains about people who are unmotivated or resistant or difficult, or if there's clients right now you're working with and you're like, that person is so difficult, take a look within yourself. Are you accepting them for where they're at right now? The most effective modes they found for using motivational interviewing was going to be drug and alcohol intervention, individual face-to-face counseling. Active journaling is a great way to do a group if you're interested in that. Telephone consultations for partners who are looking to enhance their relationship, life coaching, educating about prevention, in organizations with unmotivated staff, and combined with other treatments. Who can benefit from using motivational interviewing? Anyone who is trying to help someone make a positive change in their life as a helper, which is a very wide gamut of people. So here's some examples of some motivational interviewing questions that you can start using today with your residents. How do you want your life to be different? What are you looking for from our program? Tell me what you don't like about the way your life is now. What do you think you might be able to change? What would make it worth your while to quit drinking or to quit using drugs? What would be some advantages to being sober? How important is it for you to stay sober? So for resources, Dr. William Miller and Dr. Rolnick, who developed motivational interviewing, brought it into the United States in the 90s, now have written their 3rd book. This is their 3rd edition, and I have to say this book has really helped me become a better counselor for sure, so I definitely recommend this. Thank you very much for taking the time to listen and come to my talk today. I appreciate it.